by things early next week, Katrina.
All right, thank you very much, John. Joining us this morning, we have Dr. Ed Eaves here from the Eaves Family Dental Group. Thanks so much for joining us today.
Well, good morning, Katrina. Thanks for having me.
Sure.
And I appreciate this chance to bring some attention to the oral systemic health link.
Great. Now, we were talking about heart disease, and a lot of people might not think there's any connection between oral health and heart problems, but in fact, there is a very large connection, right?
Yeah, research is pretty clear. The Surgeon General has said that 80% of the population has gum disease, and my experience is might be higher than that. Gum disease is an infection of the soft tissue and bone that supports teeth.
Okay.
That can lead to a release of bacteria and toxins into your bloodstream, leading to a buildup of plaque in your arteries, which makes you more prone to all types of cardiovascular disease. The numbers, people with gum disease, twice as likely to die from a heart attack and 3 times as likely to die from a stroke.
Okay, so this is not something that people should take lightly.
No, not at all.
Yeah.
There's been, over the last 10 years, media has been really good about getting some of this knowledge out there, and you know, a lot of reports in the popular media.
Yeah. Let's talk a little bit about gum disease itself, because some people
Sure.
might be thinking, okay, what can I do to make sure this doesn't happen to me? What are some prevention tips?
Yeah, good question. What we tell our patients, of course, great home care is really important. What you do every day probably has the biggest influence. Things like brushing regularly, flossing, or using a water pick, using antibacterial mouth rinses. Those are all really helpful. And of course, professional care, at least twice a year, or people with gum disease are going to need to see their dentist more often. Certainly, if there's any bleeding when you are cleaning your teeth or flossing your teeth, you should see your dentist right away. Other things you can do is use xylitol.
Okay, and you've brought some xylitol in. Now, I had never heard of this before. What is it? What does it do?
Okay, xylitol is a natural sugar. It comes from plants.
Okay.
Our bodies actually make it in small amounts. And what xylitol does is it changes the way bacteria interact in your mouth. They can't adhere to the teeth. So you actually change the bacteria makeup in your mouth. And this can reduce decay and reduce infection in the gums.
Interesting. So it's working, you know, to sort of help out, aiding, brushing teeth, flossing. It kind of goes along with that.
Yeah, we tell our patients strive for 5 exposures a day. And whether you can get it in mints, gum, candy, mouthwash, toothpaste, all those things. Also should point out that xylitol is harmful to pets, even though it's natural and it's fine for humans. You need to keep it away from the dog.
Okay, well, just like many things, I mean, we've got some chocolates here and lollipops, as you just mentioned. I mean, is this something that even kids would maybe want to do?
Oh, absolutely. You know, that's something we give to kids in our practice, xylitol lollipops, and it's good for them.
Interesting stuff. Well, great advice. Thanks so much for joining us this morning.
Well, thanks for having me. I appreciate it.
Well, we want to get your questions. If you have questions for any of the guests who come on our show, you can email them into newsroom@rochesterhomepage.net. It is 6:22. Temperatures in the low 20s this morning. Up next, we're going to have some news from around the state in our New York Minute. And a wireless carrier, Sprint, lost money in the 4th quarter, but find out why there's a silver lining for the company. That's in our GRE Morning Business Report.